Assalamu alaikum. Welcome to today's cataract surgery insights into Alam's mechanical cortical cleavage dissection of this polar cataract. I am Dr. Abdurrahman Muhammad Alam going to perform this critical surgery. Stain the anterior capsule with trypan blue adequately. Now I'm checking the ball choppers. Now wash out the trypan blue with BSS. Now inject intercameral OVD to form AC prior to main port incision. Now I'm making the main port with 2.4 mm steel keratome. Now refill the anterior chamber with OVD. Always remember to underfill the anterior chamber. Now create an adequately sized capsule rhexis with the help of a cystodome. This capsule rhexis should be of 5.5 mm in size. It should be continuous, curvilinear, and circular. 5.5 mm capsule rhexis has been created successfully. Now perform only hydrodelineation in case of posterior polar cataract, because if you perform hydrodissection, it can cause posterior capsule to rupture. Replenish the OVD in AC. Now perform Alon's mechanical cortical cleavage dissection with spatula initially in 360-degree manner. Again, refill the anterior chamber with OVD. Now, with the help of a ball tip chopper, perform Alon's mechanical cortical cleavage dissection again. With the help of a ball tip chopper, if you perform mechanical cortical dissection, you can also dissect the cortex at the level of the posterior capsule. Now enter the anterior chamber with a low bottle height and perform pre-phaco and remove the superficial cortex and the epinucleus. Ensure that you have a low bottle height in posterior polar cataract. In this case, I have decided to perform modified chop for nucleus disassembling and emulsification. Now bury the phaco tip and perform vertical chop. In doing vertical chop, there is less stress on the zonule and the posterior capsule. Now you can chop a piece and emulsify this chopped piece. In doing this, you have made the nucleus more mobile, and this nucleus is easily being rotated in the epinucleus shell, because you have performed a successful hydrodelineation and Allen's mechanical cortical cleavage dissection. Now perform multiple chops and emulsify this nucleus as you perform the chops. For better stability, remove the second side port instrument and perform phaco emulsification with only the phaco handpiece placed inside the anterior chamber and emulsify the endonucleus successfully. Now only remaining part is the epinucleus shell, which you can easily remove, and with the help of a blunt spatula I have rotated the epinucleus shell. Now I am in epinucleus mode. I am slowly with vacuum, I'm slowly pulling the epinucleus out of the bag. I have placed viscoat while I have pulled one side of the epinucleus out. This viscoid has also caused dissection of the epinucleus, and now I am easily able to remove the epinuclear shell with minimum power and vacuum. The spatula guides the epinucleus shell into the phaco handpiece. Now perform viscofluid exchange before coming out of the eye. Now perform cortical removal with the help of a bimanual IA handpiece. Oops, forgot to perform viscofluid exchange. Refill the anterior chamber with OVD again. Now remove the remaining cortex from the other side by exchanging the IA handpieces. In posterior polar cataract, it is wise to avoid polishing of the posterior capsule. Now again perform viscofluid exchange prior to IOL implantation. Slightly enlarge the main port incision to 2.8 mm. Now implant the intraocular lens inside the PC bag. Ensure that the tailing haptic enters into the PC capsule, then guide the tailing haptic with the spatula inside the PC bag. Now perform stromal hydration of the main port and perform visco removal with the help of the bimanual IA handpiece. Now take the irrigation behind the IOL and wash out the OVD that was trapped behind the IOL. Avoid polishing of the posterior capsule. Now perform stromal hydration of the side port and give intracameral antibiotic injection and subconjunctival dexamethasone injection. And the case is completed. Thank you, my dear friends. Hope this cataract surgery insight was helpful in developing your surgical skills.